Hello and welcome. This is Sujata Martin at Concierge Pelvic Floor, where we treat people of all genders in Tampa Bay. We also provide care through telehealth, that is virtually, to people globally. So if you're watching because you have some kind of difficulty in the core, in the pelvis area of our body, definitely subscribe. You will get access to lots of information completely free of cost on how to take care of your health and start feeling better, healthier, and take away the pain and the symptoms you must be going through. So definitely subscribe and follow for more information. If you want to work with us one-on-one, you can contact us via our website pelvicfloortampa.com through the contact us page. Now that we have got all that good stuff out of the way, let's answer a question. What happens in a pelvic floor session for men? Now, this is something that a lot of people don't think about, that men can have pelvic health issues too, right? People think it's just people who have babies who have pelvic floor problems, or women who have had menopause that have these issues. But no, every single person with a pelvis can at some point in their life have problems in that area of their body and therefore can improve with pelvic floor therapy. So, if you are a man or a partner of a man who may need pelvic floor therapy, which is if you're having issues with erection, you're not able to get erect, you're not able to maintain erection, if you're having problem with ejaculation, meaning you're not able to ejaculate at all, it's a very weak ejaculation, or you have pain after ejaculation, you have pain after intercourse, you have bladder problems, like you have trouble emptying your bladder fully, you feel like you have to always pee, like you pee and you have to pee again in a half hour or in an hour, or if you have chronic constipation, or you work out a lot, or even if you work out not so much, but then you have pain in your lower abs, in your groin, right? If you identify with any of those, you probably can benefit from pelvic floor therapy. Now, no one is sticking anything up anywhere without your full consent. So definitely keep watching to learn what exactly goes down in a pelvic floor therapy session. So let me get my handy dandy model. So this is a model of a female pelvis. Honestly, this is because most people, 80% of people who seek out care for pelvic dysfunction are female. However, the muscles are exactly the same. I'm going to hold it up to the camera. The muscles are exactly the same except minor changes, but not a whole lot changes functionally. And this will help us know what is going to happen during a session. Okay, so when you come in for your first pelvic floor therapy session, if you book a session with me, or most providers hopefully are doing this, they send you intake forms where they ask you a lot of questions about how you are peeing, how you are pooping, if you're having any trouble with sexual functions, and of course general medical questions like any medications or supplements you may be on, and of course what your primary concerns are. Once we get through those initial questions during the session, I always start with an assessment of how you move. So I will ask people to bend over and touch their toes. I will ask them to put their hands on their hips and twist to each side to see how well their spine moves. Because again, nothing in our body is isolated or works by itself. We are an integrated system. So we check how you move, how your spine moves, how your pelvis moves in general, right? Before we even get you on our treatment table. So once we got all that out of the way, typically I will ask my male patients to be on the table. Now, this has happened to almost 9 times out of 10 that most men do not want an internal examination the first time they are meeting a provider like me. because you need to feel comfortable to participate well in a rectal exam. Now, the rectal examination is very, very different from a prostate exam. It is not as quick and done. It is not rough. At least not with me. I cannot speak for all the therapists out there, but we try and make it very comfortable. We only do it if the person on the table is able to do so. And yes, we do rectal examinations for our female patients as well when it is necessary. So typically on session 1, we are not doing a rectal exam because there's usually so much we can do externally before we even get to that point of needing to check these inner layer of muscles. Usually there's already lots going on the outside. So we get the person on the treatment table and we check their abs. So our ab muscles feed into a pubic bone, right? And that pubic bone is where the base of the penis starts. So we work through those abs, try to find if there are any imbalances and correct those. We check for strength and see if any strengthening needs to be done before we move down to the groin area and the actual bottom portion of the pelvis. So we check off the lower abs after which we move into the groin and check for the same thing. We check for tightnesses. We check for laxity or looseness, which honestly doesn't happen in men as much. And we check for coordination of the muscles externally. We would give external cueing or teach people again how to do a Kegel well, and also how to do a reverse Kegel or a relaxing Kegel well. Oftentimes, believe me, more often than not, people have a hard time letting go or relaxing than they have holding in. Kind of a metaphor for life, right? We have a harder time letting go. So once we have gotten done with the external part of the exam, when it is necessary, and in some situations we may not do an internal exam at all, like the post-prostate surgery patients, someone who's recovering from cancer and radiation, their tissues are probably going to be too fragile to allow for examination in that region. But in all other cases that we spoke about in our previous video, if you haven't seen that about male pelvic health conditions, definitely go watch that. So if you're working with someone with erectile dysfunction, if we are working with someone with premature ejaculation, pelvic pain, chronic prostatitis, hard flaccid, any of those syndromes I was going to say, or dysfunctions, we will want to do an internal pelvic exam when the person is ready. So we typically have the man lying flat on his back, and again, every therapist has their own preferred style of treating. You may find that the pelvic floor therapist you see in your geographical area may have a slightly different way of doing things. So this is how I treat my male patients or my female patients or any gendered patients who need a rectal examination. I have them lying flat on the pelvic exam table. We bend their legs back, just like you might have seen a woman get in a GYN exam. Now, we don't use stirrups or anything. We want people to be comfortable. So just bend legs back. So we are exposing this part of the body, the bottom of the pelvis. Of course, now in this image, as you can see, this is a picture of the external muscles of the pelvic floor. After the skin and fat has been removed. Now, men will not have the vagina. They will just have one single opening here, but otherwise the muscles are going to remain largely the same. So I'm going to have the person and I'm going to see this part of their body without their clothes on. Very importantly, both for my patient's comfort and because it has no real importance to my findings, I have men cover their privates with a little washcloth. Their privates meaning the penis and the scrotum. We have a washcloth that is long enough to cover both parts, and I have the man cover and move the parts over to one side while I work on the groin area and the outer pelvic muscles on that side. So meaning the man is going to move his penis and his scrotum to one side, like this, while I will then check these muscles. And then once this is done, he will move his penis and scrotum over this way, and I will check these muscles. So that is how we do an external exam. Now, when we are ready, this is probably going to be session 2 or maybe even session 3. And there have been male patients who don't want an internal exam at all, in which case that is fine. We will still make progress. In those cases, often what I do is I recommend my patient to get a pelvic massage wand. There are specific ones I recommend, and I teach them how to use the wand at home. And once they have developed confidence with that, we ask them to bring the wand in, and I would then see how they are using the wand and give feedback. If they are comfortable with it, I would then use the massage wand to orient it to specific spots and release specific muscles. And if not, then we leave it as it is. Sometimes by this point, my male patients have been okay with me trying to do an internal exam. And this is again important to first of all tell me if you are doing the exercises right. Because on the outside it may look like, okay, he is doing an okay contraction, he's doing an okay relaxation, but sometimes I need to get my hand right on that muscle to find, okay, is this muscle acting just like I want it to act? Also, just like I can release a muscle in your neck, I can release a muscle in your shoulder. Oftentimes, if I can get my hands right on the muscle that is causing you pain, that is causing you shooting nerve sensation, either on your penis, through your groin, I can probably relax and release that muscle by working on it on the inside. So that is the value of an internal pelvic exam. However, it is not necessary. And once we are done with that, depending on what we find, we would set up exercises and stretches for the person to do at home. So I hope this gives you a good overview of what to expect during pelvic floor therapy for male patients or for people with penises. For more content such as this on your core health, your pelvic floor health, pregnancy and postpartum recovery, be sure to subscribe to our channel and follow along for more. Until next time, be well. Good luck.